Histology of the male reproductive system. Here we have to understand that embryologically it is the intermediate mesoderm which will be forming the major portion of reproductive system, maybe male or female, and it is the intermediate mesoderm which will have some genital ridges. These genital ridges, they are going to form the gonads. Like in the male it will be the testis. Testis will have seminiferous tubules, and seminiferous tubules will form the sperms, which is a process of spermatogenesis taking around 64 to 74 days to complete. 74 is a better answer if you have to choose between the two values. Now, on the other hand, the intermediate mesoderm will also give us what is called as the mesonephric duct or the Wolffian duct, and this is to collect the sperm. So, once you have formed the sperm, then you have to collect them and transport. So, collection and transport of sperm is being done by some of the ducts, and those ducts which are coming from mesonephric duct, also called Wolffian duct, are going to be, you can remember four names: the epididymis, and then you will have ductus deferens, which is also called vas deferens, and after that you can talk about the even seminal vesicle and common ejaculatory duct, which will be drawing in a diagram to discuss. You'll see most of them, they are lined by the, because we are talking about histology here, it is pseudo stratified and columnar epithelium, and this pseudo stratified columnar epithelium with the stereocilia. Now, what is stereocilia? It is not a cilia, it is a long microvilli, and this long microvilli, to increase the surface area of absorption, what you want to do is absorb the testicular fluid and make it more concentrated. So, that is the purpose of having stereocilia, and they are pseudo stratified columnar. Maybe it is ductus deferens, epididymis, seminal vesicle, etc. Now, once you have this information, also you should mention that though it takes 64 to 74 days for spermatogenesis, and it should include the process of spermiogenesis also, where spermatid becomes the sperm. We will see those details in a diagram. It should include the 2 weeks of spermiogenesis also. So, spermiogenesis is a process by which the spermatid, a rounded nuclei cell, becomes elongated nuclear cell sperm proper with the tail. So, spermiogenesis, which takes 2 weeks, are included in this 64 to 74 days, but then after that, before it gets ejaculated, before the sperms get ejaculated, they have to travel through these duct system, and it might take 2 more weeks. So, some 14 days you can say are spent here also for transport basically, so that it can finally be ejaculated out of the urethra, and this ejaculation is under sympathetic system. It is the sympathetic system which will be working on the smooth muscles of epididymis, ductus deferens, and squeeze the sperm, the semen, outward towards the urethra. So, with that information, we are looking at some of the slides. You see, the very first thing is we have to remember this is the testis, which came from the genital ridge. It will have seminiferous tubules, like the magnified view can be seen, but then the sperms which are formed will be then transported to epididymis. You can see this is the epididymis, and it will have a head, body, and tail. Epididymis, the tail will then continue further as the ductus deferens, which is also called vas deferens, and this is in the scrotum. So, from the scrotum it will be going to spermatic cord, and spermatic cord will be then entering superficial inguinal ring, deep inguinal ring, and then it has to enter the pelvis, which contains the ductus deferens, which contains the sperms, the semen. So, ductus deferens then goes in the pelvis, and then it will be joining with the secretions from seminal vesicle. This is seminal vesicle, staculated structure, and it will also give us some secretions like prostaglandins, coagulation factors, or it is giving energy factor also, fructose for the sperm, and then the secretions we poured into the ductus deferens, so that together they become what is called as common ejaculatory duct. We will draw a diagram, and common ejaculatory duct will then open into the prostatic urethra. Prostate itself will give some secretions like prostate specific enzyme, and it is also giving us the citric acid. Now, that is for providing energy again for the motility of the sperm. So that is by the prostate, and then the semen including the sperm will be moving through the urethra, and then it will be exiting out like this, ejaculated under the sympathetic system. Sympathetic system works for ejaculation. Parasympathetic will cause erection of the penis, and sympathetic will cause the ejaculation. Now we have magnified this area, and we are telling this is the testis. Testis will be lined by tunica albuginea, and this tunica albuginea is sending some septa inside so that it can divide the testis into some lobules. Inside the lobules you will find there are seminiferous tubules, and in the seminiferous tubules we will see, this is a section taken here, these are all seminiferous tubules. So in the seminiferous tubules, like you can see, you will find that there is stratified kind of epithelium like appearance, and towards the lumen you will find the sperms. So these are the sperms. Basically you will find elongated nuclei, this we can magnify later to see them, and they will have tail. So towards the lumen you will have the sperms, and towards the base you will have spermatogonium. Spermatogonium becoming the spermatocyte, primary spermatocyte, second spermatocyte, and then become the spermatid, and then they will become sperm towards the lumen. You will find there are interstitial cells also, interstitial cells of Leydig, and these interstitial cells of Leydig, they will be giving testosterone. Testosterone is important for giving the secondary sexual characteristics to the male, and other functions also it is having. Now as the sperm is formed in the seminiferous tubule, it will be moving towards the straight tubules, and from the straight tubules it will be going towards the rete testis. There is a rete testis here, some network like tubules, and here it is the myoid cells which are around the seminiferous tubule. If you look at the magnified view, you will find there are some myoid cells, and they have actin filaments, they are contractile, and their gentle contraction keep pushing the semen forward towards the rete testis. Now why the sperms themselves not moving? Because they already have tail. Maybe the sperms are having tail here in the lumen, but they are not yet motile. Remember, in the epidermis they gain progressive motility, so they gain P for progressive motility. So sperms are getting progressive motility in the epidermis. They are also stored, storage before ejaculation in the epidermis, especially the tail part of epidermis, and they are also undergoing maturation. So sperms get matured, and so this PSM happens in the epidermis, but then continues in the ductus deferens also. All of these are MCQs, so you should be careful about them. And as we have mentioned, the lining epithelium of epidermis or ductus deferens is pseudo-stratified columnar epithelium, and they will have stereocilia, which is long microvilli to increase surface area of absorption. You just want to keep absorbing the excess of fluid and making the semen more concentrated. So once the sperms are in seminiferous tubule, then they go to straight tubule to the rete testis. From the rete testis you will find there are efferent ductules. Efferent means exiting, outgoing, and all that is coming from genital ridge. So genital ridge give not only seminiferous tubules which will form the sperm, but it is also giving straight tubule, rete testis, and even the efferent ductules. The Wolffian duct will give us the epidermis, and after epidermis, like you can see, it will also give us the ductus deferens, it will also give us the seminal vesicle, it will also give us common ejaculatory duct. So that is some basic introduction, and we can draw it ourselves also. We want to talk about the structure. So say this is the testis here, and this testis is lined by what is called tunica albuginea, and this tunica albuginea, what it is doing is it is giving septa inside, so that you can divide the testis into lobules, and inside the lobules you will have seminiferous tubules. So these are the seminiferous tubules, and they will be forming the sperm. So seminiferous tubules, they will be forming the sperms. that is where spermatogenesis occur. And remember, spermatogenesis is the process of formation of sperm. It will have cell divisions including mitosis as well as meiosis. Meiosis is the process by which you will reduce the chromosome number to half, because sperms are obviously haploid cells, and that can happen only after puberty. Remember, spermatogenesis begins only after puberty. Before puberty, you might have spermatogonium but no sperms, and that is why one thing is important: blood testis barrier. Blood testis barrier is important because the thymus has already trained the T lymphocytes, and by puberty, thymus is gone. So, T lymphocytes are already trained to self cells, but the sperm is formed after puberty. Now, if sperm is formed after puberty, for the T lymphocyte, it will be an antigen and it can attack the sperm and kill the sperm. So, that is why you need blood testis barrier, which will be formed by the Sertoli cells, and Sertoli cells, they are in the seminiferous tubule. They hide the sperm. So, how do they hide the sperm? By forming blood testis barrier. They don't let the blood components come in exposure to the sperm. Otherwise, if there is a testicular damage and somehow blood cells reach the sperm, they start killing the sperms. Auto antibodies will be formed, they'll kill the sperm. Infertility. So, you don't want the sperm which comes after puberty to be exposed to T lymphocyte, which is already trained before puberty by thymus. Otherwise, they'll kill it. So, all that is important. Now, we have learned that the sperm was formed in seminiferous tubule, then goes into straight tubule. This is the straight tubule, and from the straight tubule, it will be going into the rete testis. This will be rete testis, some network of tubule, and from the rete testis, it will be taken out by the efferent ductules. Now, all of these, efferent means exit, are coming from genital ridge. Then what is Wolffian duct giving? Wolffian duct is the next thing you can mention here. It will be giving us the epidermis, which is having a head, a body and a tail, and this epidermis of course will come from Wolffian duct. Wolffian duct, which is other name of mesonephric duct, not only it will give number 1 epidermis, it will also give the ductus deferens number 2, and it will be also giving us what is called as the seminal vesicle. Seminal vesicle will pour the constituents, as we have told. Seminal vesicle will be giving us the citric acid for the energy, providing energy to the migrating sperm, moving sperm. It will also be giving us coagulation factors and some prostaglandins, etc. So, all that is given by seminal vesicle, poured into the ductus deferens. Together they will, when they join, they form common ejaculatory duct, and common ejaculatory duct will then be, so number 1 is the epidermis, number 2 is the ductus deferens, and number 3 is the seminal vesicle, and number 4 is the common ejaculatory duct. They are all coming from Wolffian duct or mesonephric duct, the collecting and transport system of the semen or sperm. Now, this sperms, they will be entering into the prostatic urethra, and then from there they can go to the membranous urethra, spongy urethra, and exited out, ejaculated under sympathetic system. Prostate itself will be giving some contributions like prostate specific antigen, and it is also giving us the citric acid, as we mentioned, for the providing energy for the movement of the sperm. And remember, the seminal vesicle is giving alkaline secretion. That secretion is alkaline because the sperm are supposed to enter the vagina. Vagina is acidic in nature, so kind of neutralizing factor can be discussed here. And it is the epidermis we have mentioned that PSM will occur. What is PSM? The progressive motility of sperm. S for storage before ejaculation. M, the maturation. All that happens in epidermis, and tail is for the storage before ejaculation. But this PSM continues into the ductus deferens. My point is, when somebody is asking for progressive motility and all that, you should answer it as a epidermis. If not found, then it continues in the ductus deferens also. So second answer could be ductus deferens, which is also called vas deferens. Now, with all that information, let us zoom the area of the seminiferous tubule. This is one of the seminiferous tubule. There will be some connective tissue around that. This is another seminiferous tubule, and this is another seminiferous tubule here, and this is another one. In between, you will have the interstitial cells of Leydig, which will be giving us testosterone. They are very large cells, eosinophilic, and that is why pinkish, more pinkish. And these interstitial cells of Leydig, they will give us testosterone. As we have mentioned, testosterone is important for the secondary sexual characters of the male, and it has other functions also, like testosterone will stimulate. Testosterone works under the LH hormone. These interstitial cells of Leydig, actually interstitial cells of Leydig, they work under LH hormone and they give the testosterone, and testosterone will be important not only for the secondary sexual characters, other features also, and it is going back also to give the feedback inhibition. We will discuss this again in the endocrine system, working upon the hypothalamus and pituitary, so that if you have excess of testosterone, you can always tell the hypothalamus or the anterior pituitary to reduce the amount of LH, and as you reduce the amount of LH, the amount of testosterone secreted by Leydig cell will also reduce. Now, that was about the interstitial cells of Leydig. They are outside the seminiferous tubules. Seminiferous tubules are where the sperms are formed. So sperms will be in the lumen. There is a abluminal space and there is a adluminal. So we use the two terms. There is abluminal, which is towards the lumen, and then there is adluminal. Adluminal means towards the base, and this is towards the lumen. So a question comes, arrange the cells from the base towards the lumen side. So of course, towards the lumen side, what you will have is the sperms. Sperms will be here. We'll draw this again. Towards the lumen, you will have sperms. Then which cell is towards the base? Actually, it will be the gametogonium, which is spermatogonium. And after that, you will have the primary spermatocyte, secondary spermatocyte, and spermatid, which can be seen here. Can be seen here also. So which is the first cell? Say if they have taken a section like this, they have taken a section from here. So which cell will be towards the base? That is the spermatogonium. Spermatogonium is the first cell which you will see, and it is undergoing mitosis. The cell which begins meiosis is primary spermatocyte. So primary spermatocyte will go into primary meiosis, that is meiosis 1, to give us secondary spermatocyte, which usually is not seen because it is very transient kind of cell, immediately changing into spermatid by the second meiosis. So secondary spermatocyte is transient and it undergoes secondary meiosis, that is meiosis 2, to form spermatid. Spermatid is having round nucleus, and then it will undergo spermiogenesis to form spermatozoa, and the spermatozoa will have elongated nucleus and tail-like process, and the spermatid changing into spermatozoa is almost 14 days, 2 weeks, and this is included in the 74 days, means 60 days for the actual process and plus 14, total 74 days for finally forming a sperm from a spermatogonium. So spermatogonium to sperm, you take 64 to 74 days. 74 days is a better answer. Here you will see there are very large cells which are coming from the base and reaching till the lumen level. So coming from the base, reaching the lumen level, that is the Sertoli cell, sustentacular cells, and they have supportive role for the developing sperms. And these cells, you will find they will have lot of processes which are interdigitating with the next cell. So you see this is the next cell, and they are holding arms. Now why they are holding arms? They are holding arms to create what is called as the tight junctions, and these tight junctions are important. We'll draw our own diagram. to create the blood testis barrier. So blood testis barrier is being created by these tight junctions, one Sertoli cell here, one Sertoli cell here. You can see Sertoli cell nucleus is very large. This is the largest cell you will find here if you are talking about Sertoli cell compared with the germ cells. In the germ cell, the largest is primary spermatocyte. So primary spermatocyte is the largest cell of all the germ cells. The point is that these blood vessels which are outside, they can have T lymphocytes, and those T lymphocytes can come and kill the sperms which are in the lumen. That won't happen because these Sertoli cells, they are making these tight junctions like this. So these Sertoli cells, as they are making, this is another Sertoli cell now. So as the Sertoli cells, they are making these, this is one of the Sertoli cell, and that is another Sertoli cell. So these tight junctions, they don't allow the T lymphocyte or blood components from outside to move inside toward the sperm. That is not allowed. That is called blood testis barrier. So who is forming blood testis barrier? Blood testis barrier is formed by sustentacular cells. They'll have the largest nuclei and the largest cell in all of these. So all that information you need. And as we have told, towards the base you will have spermatogonium undergoing mitosis to form more of spermatogonium. One fine day it will form primary spermatocyte. Is the primary spermatocyte which will undergo primary meiosis, that is meiosis 1, so that it can give us secondary spermatocyte. The secondary spermatocyte is undergoing secondary meiosis, that is meiosis 2, to give us the spermatid. Spermatid will be round nucleus, and it is the spermagenesis which is converting the spermatid into the spermatozoa, which will have this tail and elongated nuclei towards the luminal side. So abluminal, and that is basal. So adluminal, all those terms are important, you should remember. Once you have all that information, you can draw the diagram yourself also. You are telling that this is, say, testis. In the testis you are having this tunica albuginea forming the septa, and then you have taken a histology section. So let us show that these are the seminiferous tubules, and if these are the seminiferous tubules, then in between you will find that there are some cells which are quite large eosinophilic cells, interstitial cells of Leydig. Interstitial cells of Leydig, they give the testosterone, and if you are talking about the seminiferous tubules in the lumen, you will find that there will be sperms. So in the lumen you will have the sperms. Let us magnify this here. This is the seminiferous tubule now, and the sperms will be in the lumen. They will have a tail, but the cell which is towards the base will be spermatogonium. So spermatogonium, then you have primary spermatocyte, as I mentioned. Secondary spermatocyte may or may not be seen, secondary spermatocyte, because it is transient, quickly changes into the spermatid, and spermatid will then change into spermatozoa. This is the spermatozoa. So that is a sequence from basal to the luminal side, because again, see, whatever we are teaching, they are all MCQs, already appeared and have a tendency to appear again and again. Now once you have told all that, what about the Sertoli cells? Sertoli cells, like we discussed, they'll be extending from the base towards the lumen like this, and actually sperms are held at their apex. Sperms will be held like this. So this is the apex of the Sertoli cell, and that is where the sperms are hanging. And the Sertoli cells, as we can see, they are coming from the base till the lumen level, very large cell, and they'll have very large nucleus like this. This is the nucleus of Sertoli cell. Sertoli cell is also called sustentacular or nurse cell. Nurse cell because they are giving nutrition, metabolic requirements of the sperms are met with. They give hormones also. So what hormones they are giving? Like Mullerian inhibiting substance. During development, you have to inhibit the Mullerian duct, then only Wolffian duct will develop. So Mullerian inhibiting substance they are giving to inhibit Mullerian duct and let the Wolffian duct develop. Wolffian duct will give you epidermis, ductus deferens, seminal vesicle, common ejaculatory duct. And Sertoli cells, they are also giving us what is called inhibin. Now what is inhibin? Inhibin, as the name is suggesting, it will inhibit what? Feedback inhibition. Basically it will be going to the anterior pituitary, and at the anterior pituitary it will tell the anterior pituitary to reduce the level of follicle stimulating hormone, so that you don't have crowding of the sperms, because there can be too much of sperm, excess of sperm, you don't want that. So there is a feedback inhibition, though the Sertoli cell is of course helping in spermatogenesis, formation of sperm, but it works under follicle stimulating hormone actually. So when the Sertoli cell was working under follicle stimulating hormone, if there is too many sperms, then it will give inhibin. Inhibin will go have feedback inhibition on the anterior pituitary. Anterior pituitary will reduce the follicle stimulating hormone, and as you reduce the follicle stimulating hormone, there will be less of spermatogenesis. We will discuss this again in endocrine system. All of these are MCQs. Now this is one Sertoli cell we are showing. Let us show another Sertoli cell now. And as you are showing another one, this is the other one, they are holding hands, you see, they are holding hands. So as they hold the hand, this is another one, this area where we can show now is having what is called as the tight junctions, and those tight junctions are important. So what is the importance of tight junction? You see, there was one blood vessel here outside, and these blood vessels, they will have say T lymphocyte. That T lymphocyte which is there in the blood vessel should not be coming in contact with the sperms, because sperms form only after puberty. Spermatogenesis begins only after puberty, whereas T lymphocytes are trained before puberty, because thymus degenerates after reaching, as you reach the puberty it is gone. So T lymphocytes are already trained, they don't know, for them the sperm is an antigen, and if you expose, then they'll kill the sperm, decreasing fertility, and they are also, there will be autoantibodies formed. So how do you prevent this T lymphocyte? See, this is not, these tight junctions, they don't allow the sperm to move like that. That is blood testis barrier. So by creating these tight junctions, these are the tight junctions, the Sertoli cells, they are creating blood testis barrier. With all that information which you have here, we can talk about the spermiogenesis also. So what about spermiogenesis? Spermiogenesis is the formation of spermatocyte from the spermatid. Spermatid is small cell with rounder nuclei, but sperm will have elongated nuclei. Actually, the DNA condensation is into 6. So DNA undergoes condensation, and you'll notice that the nucleus has become elongated. Now this elongated nucleus, which has the DNA, it is haploid of course, because it is undergoing meiosis, reduction division, especially meiosis 1 is a reduction division, reducing 2n into n. So all gametes are haploid. There will be Golgi bodies forming acrosomic cap. So this acrosomic cap which you see is formed by Golgi bodies, and the Golgi bodies, as you know, they will be packing some of the enzymes like acrosin enzyme. So in the acrosome you will have acrosin enzyme. Acrosin enzyme is important because it will help us in penetrating zona pellucida. So it will help us in penetrating zona pellucida of the secondary oocyte for the purpose of fertilization. Now what about the neck region? What is there in the neck region? Neck region, you will have the primary proximal centriole, means there are two centrioles, and the centrioles, they have this 9+2 mechanism for motility, but the first, the proximal centriole will be in the neck region. Again come as a question. Where is the secondary or the distal centriole? Distal centriole actually forms this tail. So this tail is formed by the distal centriole, and again having this 9+2 arrangement. Centrioles have this arrangement. So there are two centrioles, distal will form the tail, and this, though we call it as flagellum, it is not a flagellum. We call it as flagellum, it is not a flagellum, it is a long cilia, and that long cilia is important for motility. Now you will find that sperm need the energy and energy is given by the mitochondria in the middle piece, M for M. Mitochondria in the middle piece, and they are arranged spirally, spiral arrangement of mitochondria. So this is the mitochondrial sheath. As you know how to draw the mitochondria, they will have those cristae. So spirally arranged mitochondria giving energy, M for M, mitochondria in the middle piece. So that is a spermatid. Spermatid was just like this cell. This cell was spermatid. How the spermatid became the proper sperm with the tail and condensed nuclei is spermiogenesis and taking around 14 days or 2 weeks. So that is all we want to discuss in male reproductive system.